The effects addiction can have on a person is drastic and is oftentimes deeper than someone trying to help that person can even realize. I'm Sarah Blakely, Morning News co-anchor at TV6 and your host for the Portage Health Foundation Addiction Series. In this episode, we'll hear from Mark Maggio of the Phoenix House, Rebecca Crane with Dial Help, and Dr. Adam Frimodig from UP Health System. They'll dive deeper into the negative health consequences addiction can have.
Well, it definitely has a negative consequence to the person's overall health. You see nutritional issues, deficiencies in vitamins and minerals necessary for normal living, problems associated with the direct substance on their physical body, whichever, with alcohol, it could be liver or kidney, heart issues, the list goes on, but it has a significant impact on general health issues, no doubt about it.
I think on a personal level, I think it erodes every aspect of a person's health, physical, cognitive, their relationships, their employment, sometimes even housing. And for our agency, all the things that I mentioned that we do, alcohol and substance abuse is permeated all the way through all of those different departments. From the calls that we're receiving, even our intensive family support services, the children in the home are at risk from abuse and neglect, but about 50% of the time it's because the parents are using. So I can't overstate enough how it seems to find its path into every service division that we have and had all these years.
So it has a drastically wide range of effects on physical and emotional health. The ones that are the biggest, most common ones that you see that we're aware of directly due to substance use disorders. More often than not is due to people that are injecting medications. So we're looking at hepatitis C, HIV, hepatitis B, infections at injection sites. These are the ones that we would first off think are the most common with drug abuse. But really the bigger problems that we see is significant emotional changes. So whether it's anxiety, depression, you can even have bipolar be induced by medications or alcoholism. So this is a huge factor that basically makes them to be tough patients, which is why they don't always get the greatest care or they get pushed from one office to another. As far as other effects on their overall health, generally people that are in active substance abuse are not taking good care of themselves. They're not sleeping, they're not eating right, they're not exercising. So we're gonna see high blood pressure, we're gonna see insomnia, we're gonna see weight loss to the point where they don't have enough calories to survive at times. Back pain is another thing, and this is one that really gets complicated and is really tough to treat. So there's a phenomenon out there known as opioid-induced hyperalgesia, which basically means the more pain medication you take, the more pain you have. Where light pain, like just touch of a hand, will cause pain because the opioids actually stopped treating the pain and actually intensified the pain receptors. And once you are at this point, it doesn't matter how much of a pain medication you take, it's not going to help and it's just going to make it worse. And the way to treat that is to stop opioids. And you can actually then restart them if they have legitimate pain at a lower dose and it'll help. But it's really tough when somebody's been taking heavy doses of opioids and the doctor says, well, we need to stop these for at least 2 weeks to let this reset and then we can treat your pain better. When they've been on this dose for 5 years, 10 years, they're not going to want to do that. But sometimes that's what's needed and it's really tough.
The impact of addiction is so significant it can erode every aspect of a person's health, but it doesn't have to be that way. Today we heard from Mark Maggio, Rebecca Crane, and Dr. Adam Frimodig, and in episode 9, all three of them will be back along with 4 other community leaders to talk about the solutions to the addiction problem in the Keweenaw. If you or someone you know is struggling with addiction, know that there are resources available in our community. Dial Help is a great place to start. They have a crisis line 24 hours a day, 7 days a week, based right here in the Copper Country. Just dial 906-482-HELP, text 90635-NEEDS, or chat live with someone at dialhelp.org. If you're in any kind of medical emergency, dial 911 immediately. To learn more about the resources available in our community or to subscribe for email alerts for future episodes, just visit phfgive.org/addiction.